Hello, my name is Sabrina Prier, and this timeline presentation will focus on 400 years of medical inequities in the Black or African American community. And this will cover the time periods round about the turn of the 17th century all the way through the present day, which is 2020. Some of the background coming from the inequities with the Black Americans in the United States really stems from a storied history of how we got here in the first place. But before that, I want to talk about some of the evidence-based philosophies of public health and evidence-based medicine. When we implement these types of philosophies and medical practices within the community, then you start to notice an entirety of health, not just within certain populations, but within the entire community. And this is very important because the old adage that reads, what's good for the goose is also good for the gander, has obviously not been fully implemented into our public health system or our medical communities as well. When we do implement evidence-based research, then disparities are pretty much eliminated, or at least they are greatly decreased. And that is very important because public health philosophy as a whole cannot really accomplish its goal when facets of the population are massively disproportionately impacted by health disparities. Looking at some of our trans theoretical models of change, as well as adult learning theory, they're both kind of merged as we think about how our public health system has been impacted. So trans theoretical models of behavioral change also align with mind changes or attitude changes, and we can't have a behavioral change before an attitude change. And many of us, many of in the health community, are still in that pre-contemplative mode where there's not even an acknowledgement of a disparity, or there's apathy. So there's no change, there's no movement, there is no systematic effort in order to dispel these inequities. But adult learning theory runs right into that because adults have a tendency to be extremely resistant to change. And unless there is an immediate benefit to them and they are involved in the process, it is extremely difficult to change someone's mind, especially if they are a little older, past kind of the millennials, even the baby boomers and Generation X. Those people are kind of ingrained in their thought processes and their ethics and morals, and even if it's wrong. So getting those people to change is a tremendously detrimental type of challenge that we have right now, because many of those people compose the health system. They compose, there are doctors and our nurses and our ancillary health professionals. So we have to be able to involve these people in the process when able, and that generally starts from younger. But if we have to wait until adulthood, the problem is much more amplified, and we have a much more difficult time moving from pre-contemplation into a planning, an action, and a maintenance phase. Some of the history that talks about the inequities actually starts around about the turn of the 17th century, when Jamestown was being colonized. And this is about 400 plus years of mistreatment towards Black Americans or Blacks in the Americas. It commenced with the transatlantic slave trade to the Americas, and this this journey from Africa all the way to the Caribbean and to North America was a horrific journey, plagued with illness and death and disease. And once they got to Jamestown, once the slaves and the settlers arrived in Jamestown, that treatment that they experienced on the boats really didn't get any much better. These poor treatments during the sea passages provided death for hundreds of thousands of slaves. And many of those deaths obviously were due to the health conditions on board and the cramped spaces. And then when they arrived, additional deaths resulted because of untreated illnesses and disease, starvation, dehydration, and a litany of other diseases that were on board that a lot of these people hadn't been exposed to in their home countries. Continuing on, we look at some of the acute and chronic distress that slaves in the boats coming over from their homeland through the transatlantic slave trade, look at some of the things they experienced. And we often focus just on the physical health and our bodies, but there are so many dimensions of health, including your social aspect, There is the cognitive aspect of health, the emotional aspect. There's even religious aspects, really, but the psychological, physical, social, cultural, and familial are the primary ones that enslaved Americans or enslaved Africans suffered when they were kind of coming over here through that journey. Psychological distress, poor nutrition. There certainly was not an abundance of fruits and vegetables on board. There was a social removal from their activities, their groups, they were separated. People were torn from their families. Their language was stripped away from them. They weren't permitted to practice some of their religious type of dealings. And it was just a horrific occurrence for them altogether. And so now remedies that these individuals suffered coming over through the slave trade and arriving into Jamestown, none of these have really been dealt with. We've ignored the impact that they have had and the generational impact that it has had, because trauma doesn't go away after one or two generations, and that's biblical, where it says, the sins of the father are carried on into the third and fourth generations. Well, trauma is also carried on, and patterns of behavior are carried on. And these types of distressed environments early on really have not been adequately resolved, even from a mental health point of view. Continuing on with history, and I'm just going to hide my face right there so you can see the chart there. In 1863, the abolition of slavery occurred, and some of those slaves still weren't really freed until June 19th, which is what we celebrate as African Americans as Juneteenth, because some of the slave masters decided to not inform slaves, primarily those who were closer to the Mississippi line, that slavery had been abolished and the slaves couldn't read or write and didn't have access to social media or phones because they weren't invented yet. So they just didn't tell them and waited for a couple of more crops to come in, and the National Guard finally had to relieve those individuals. So think about that as well, how finding out that you were free several years beforehand, think of the emotional distress that played on these individuals and how it also impacted their physical health. So 1863, slavery was abolished. 1964, the Civil Rights Act was enacted. However, it was not sufficient to really remedy all of the disparities that had been suffered up to that point. So slavery was abolished and the Civil Rights Act passed, but it wasn't as if everything's okay. Congratulations, you are equal and free right now. Let's go ahead, and computer's freezing a little bit there. And so everything wasn't all bells and whistles when slavery was abolished or the Civil Rights Act passed. They still faced high levels of scrutiny, violence and death ensued. There were lynchings, hangings, just mobs. Bloody Sunday was a horrific event that occurred in Alabama, and even Martin Luther King Jr. himself said that Birmingham, Selma, Alabama were two of the most racist and discriminatory cities on the planet. Moving on, now we look at how Black Americans, as a result, face substantially higher morbidity and mortality rates. And all of this can be derived back from civil rights movement, abolition of slavery, because if you have to fight for basic rights, then you're certainly not going to be held in the highest regard when it comes to public health. So history plays a large part in helping us to understand why disparities occur and how we can dispel those disparities through education and through having a sense of empathy and upholding ethical and moral guidelines, which medical practitioners are really meant to uphold and about to uphold in the first place. When we look at the practitioner care, it's heavily biased, which is part of the reason for the disparities. We also see the standard of care is much lower for Black Americans, and that's why they die in higher rates. So not only is our incidence rates higher for Black Americans in pretty much every health category, but their morbidity or their death rate is also higher. And society frequently presents as uncaring and apathetic. Looking at the chart, we see the instances of high blood pressure, diabetes, and stroke are significantly larger for African Americans versus their white counterparts. And when I say significantly, every synonym that corresponds to significantly should be used. It is outrageous, the disparity rates between our white Americans and even our Asian counterparts and African Americans, it really just goes to show you how discrimination and racism and apathy have played into their care and treatment over centuries. So looking back now at the turn of the 16th or 17th century through the 1860s, these horror conditions on board really perpetuated many of the illnesses that slaves had and even carried into the Americas. This chart on the, or picture on the side, shows you just how massively cramped these ships were. There often wasn't enough room to turn around or to move freely. People were chained to one another. There was dehydration and scurvy. Many committed suicide by jumping over because they did not want to live a life of enslavement. And because of that, of course, slaves were considered cattle and property, and people did not want to lose their investments. So some of the slaves began to be force fed, and they were subjected to torture if they did not eat. So they weren't even allowed to kill themselves. Just imagine the mental health disparities that stem from you wanting to die and not even being allowed to take your own life. So these are some of the things that these traumas are inbred in our DNA and passed down. And this is part of the reason why some areas with mental health and also with physical health may have a little bit more difficulty being treated amongst the Black community. So in the 1700s and through the middle of the 1860s, enslaved Blacks were extremely distrustful of their slave owners and their physicians for obvious reasons, and began to self-treat. Now, some of these self-treatment methods stemmed from the things that they did back in their own home countries. However, they weren't introduced to certain illnesses and diseases until they arrived in the Americas or were transported through the transatlantic slave trade. And so now they are trying to treat illnesses that they have no experience with, and often that led to an increase in whatever their condition was. So enslaved Blacks were very distrustful. They did not trust the doctors, they didn't trust anybody, and they would oftentimes refuse treatment. They would oftentimes refuse treatment and self-care. This often led to increased illnesses, of course. The slave owners fought vehemently to be able to have their doctors treat the slaves because, of course, their human capital value, and the South at that time was heavily agricultural, whereas the North was much more industrial. And so losing slaves was considered a huge loss of really equity and property, because the slaves were the ones that built up the property and harvest the crops. So they wanted to protect their investment. Having said that, the care that was received was greatly experimental many of the time, and we're going to get to that in a moment. Actually, right now. So in 1845 through around about 1849-50, many of the enslaved women were forcibly used as experimental guinea pigs for gynecological examinations and research purposes. James and Marion, and is missing there, Sims, experimented with Black women with absolutely no consent nor care. It's quite cruel. No anesthesia was provided to these women, even though anesthesia was available, because this individual claimed that Blacks had a higher pain tolerance, with absolutely no evidence, because it's not true, so he couldn't find any, but he claimed that they had a higher pain tolerance, and they didn't need anesthesia, and also that the anesthesia was just too much trouble to go through, and it wasn't worth it for the procedures that he was performing. Keeping in mind, as we look at the photo over here, that a vaginal fistula, and there are also several different types that can oftentimes come from childbirth, is a hole from necrotic tissue that is formed as a result of childbirth or another, maybe a congenital defect, and it starts to leak urine. Sometimes if it's closer to the anal cavity, it can leak fecal matter and to come through the vaginal canal. And so it's extremely unhygienic, but also it can cause a litany of infections and even death, including by herniations. So this was something that this doctor was experimentally fixing with no anesthesia for these women. So to fix a hole, there's probably going to be some sutures and things of that nature, and no anesthesia was provided. So this is the treatment. This is medical treatment, and of course, it built even a higher level of distrust and even hate towards practitioners. So many women now, of course, greatly benefit from his inventions, but this individual, J. Marion Sims, was revered and given money and medical advances and fame for the work that he did on enslaved women, which was quite cruel. In 1910, sickle cell anemia was reported in the literature, and it remains today severely unresearched. Sickle cell anemia, looking at the image to your right, it really does have a tremendous impact on blood flow and iron in the body, oxygen flow in the body. It affects primarily African Americans with a rate of about 1 in 5,000 Black Americans, and that is also not including those who carry the marker. Extremely high premature death rate, where death is oftentimes in the early to mid 40s for men and women. Some of the carriers are asymptomatic, or if they have the markers, they're also asymptomatic and may pass down the gene to their children. Unfortunately, it's not well funded, but it does plague the Black community very much so. It's not well funded. It's not supremely well researched in accordance with some of our other diseases that we hear so much about, including cystic fibrosis and sickle cell anemia. Per capita affects more people in the Black community, and it has nowhere near the amount of funding and research as does cystic fibrosis, nor prominence in the community. People just aren't aware of even how to treat it outside of the communities that are directly impacted. So our normal blood cells should be nice and cyclical in nature, not crescent shaped. They can clot. And of course, clotting brings all other manner of illnesses such as low circulation, low blood flow. It can lead to tissue damage and even stroke. Type 2 diabetes is another area where disparities are just galore. It is a silent killer, and sometimes for the Black community. And when we look at type 2 diabetes, which formerly was known as adult onset diabetes, but now it's known as type 2 diabetes, it's one of the highest leading causes of chronic death in the United States, but even significantly more for the Black population, 60% higher, and that is just increasingly massive for this community. When we look at access to care and treatment, it's extremely poor, and it's also amplified by food deserts in poor communities where they don't have access to fruits and vegetables. And if they do have access, then the pricing is generally outside of what the poor communities can afford. So if you're living on SNAP benefits, or if you're living on TANF, which is temporary assistance for needy families, if you're getting WIC, then that's not necessarily enough to routinely buy organic or healthful foods and fruits and vegetables, which is what really type 2 diabetes needs the most, because according to the USDA, half of your plate by weight, not by volume, should be composed of fruits and vegetables. So if you don't have access to that because of money or food deserts, then your type 2 diabetes is going to not only be significantly more difficult to treat, but you also have a much higher rate of mortality. And that is exactly what is happening in the Black community compared to the white community. So much so to where Black communities are 3 times as likely to have a limb amputated because of that. And we can look at the image to our right and see that necrotic tissue can result in diabetes from blood flow, nerve damage. Things like gabapentin often have to be taken for the nerve damage, but if you can't feel anything, you can oftentimes incur injuries and then not treat them because you didn't feel that the injury was there. So they're much more likely to have amputations, and also 5 times as likely to suffer from renal failure, which of course we can't live without our kidneys. And if you are on renal failure, then you have to go for kidney dialysis, which is not only expensive but time consuming, and then throw in the transportation issues or the access or lack thereof to clinics that are close by, and the money it costs and gas to get there. And we see just a massive disparity with type 2 diabetes as well. As we move on to 1932 through 1972, roundabout, we come to the Tuskegee experiment. And the Tuskegee experiment really was one of those horrific blots on American history, whereas this was a government funded project, administered by the United States Public Health Service, funded and administered by them, which involved 600 plus Black Americans for the treatment of syphilis. And just the experiment itself was discriminatory because they only recruited Blacks, and there was a false assumption that Blacks were just more promiscuous and therefore we're much more prone to STIs, STDs, which is of course not true, but that is the basis to where the federal government came in and recruited these men, told them they were being treated for bad blood, and then did not treat them at all, even though syphilis was easily curable with penicillin, and this was widely available, but of course it was not provided to these participants. So over a 40-year span, we're looking at people who have not been treated for syphilis, damaging effects, not given penicillin, extremely painful side effects. The men were passing it on to their wives and their children. So decades and decades, generations have been adversely impacted. Kids were coming out with birth defects. Women were having gynecological issues and stillbirths. And there was massive pain and inflammation and nausea, in addition to psychotic breaks. And not until 40 years later, when a whistleblower alerted the New York Times what was going on, was this experiment stopped. And by that time, most of the people had died. But the inclusion of the wives and the children, there's no telling the impact and how far this experiment really reached for the Black population, and it has only amplified the Black population's distrust of the medical community. Moving on to 1951, where we now have Henrietta Lacks and what are now referred to as her HeLa, or everlasting and undying cells. So this young lady was a married mother of 5, and she had been complaining of abdominal and lower and stomach pain. She was found to have a large tumor when taken to Johns Hopkins, which at the time was one of the only facilities that treated Black patients. And her cells were sent upon biopsy and confirmed to have a malignant tumor. However, against her knowledge or consent, tissue samples were sent out to a cancer researcher who was studying cancer and treatment methods, etc. And he discovered that her cells just didn't die like everyone else's, whereas other people's died within the day. Hers actually multiplied and doubled within 20 to 24 hours. And as a result, her cells have been used since 1952 when she died later on, or late 1951. Her cells have been used as the basis for many medical experiment. Vaccine, the polio vaccine, was heavily dependent upon the use of her cells. Her family was not notified, no compensation has been provided, and they were only notified of what happened when there was cross-contamination with some of these HeLa cells from another institution, and they found the family's information and then wanted to talk to them and interview them about how their DNA has helped cure many a disease, and could they further study and have samples. So this was still and is still one of the greatest injustices of medical history, particularly when it comes to the Black population, because this woman is literally responsible for saving millions of lives based on her cells. In 1960 to 1971, we again see disparities with poor Black cancer patients being subjected to medical experiments which were previously discredited for lack of evidence-based research results. And so now we look at these Black patients, and there were almost 100 of them, 90 or so. And the x-rays and the radiation treatments from this particular doctor, Dr. Sagener, were previously unproven. However, these Black young men, older men, were recruited. They were told that this treatment would help them, and of course it did not. It was a flat out lie. And they were exposed to 20,000 times the amount of radiation that a normal person would be exposed to. And of course, every side effect that one could imagine resulted from nausea, pain, gastrointestinal issues, mental confusion. They had psychotic breaks. I mean, you name it. And most of them died of radiation poisoning. The same doctor, similar to J. Marion Sims, who was the individual who decided to perform guinea pig experiments on enslaved Black women, this doctor was now revered and given career accolades and fame. So there's a history of not only poor treatment for Blacks, but also rewarding the individuals who have subjected them to that treatment and not providing remuneration or even credit or acknowledgement for the efforts and the unintended efforts and the lives that were lost based on the way that these individuals were treated. Coming now towards the middle late part of the 20th century, we look at now there's another disparity, and that's a massive underrepresentation for Black healthcare workers. And this includes nurses and doctors, PAs, LVNs, CNAs, physical therapists, occupational therapists, mental health practitioners. Particularly, we often forget about the mental health practitioner component, which is huge in the Black community because mental health is already ostracized everywhere, but particularly in the Black community, it is ostracized and not talked about. Because we've been trying to survive for all of these years, there hasn't been a lot of time to focus or give credence to this aspect of health, this dimension of health, emotional, psychological wellness, which actually has a direct impact on our physical health. And so it's very important that we include mental health practitioners and psychiatrists, psychologists in this assessment and this timeline of underrepresented Black healthcare workers. So now looking at and this won't move there, that show active speaker video, but we look at quality of education and funding is substantially lower in Black communities, all minority communities really, but particularly in Black communities, it is substantially underfunded because housing taxes usually go to fund the schools that your children attend. But if there is already economic disparity, then of course there is going to be educational disparity in the schools. The inner cities typically perform far below the schools in more residential based neighborhoods. So there's a lack of quality education, and that directly impacts these individuals, Black kids, Black teens, their ability to get into quality schools and do well and be able to go into healthcare careers. So instead we have an overrepresentation in trades and blue collar workers for Black Americans and a massive underrepresentation for white collar and healthcare careers, which would directly impact us as a community and helping to solve that divide and curb that disparity rate for Black, white, and Asian differences in healthcare. So the schools are poor, they're not well funded, there's mistrust among Blacks, even in the educational system, because the educational system is what trains the physicians, so there's distrust everywhere. And of course, the Blacks are delaying their treatment. So if there are more Black workers, and even Eric Walsh made a point to say last year in 2019 at the Black Alumni of Loma Linda, their annual ball, he made a point to say that the lives of people who look like you, who look like me, are literally dependent upon more Black practitioners, more doctors coming into this field. So it is literally a life or death situation. And it is an epidemic that there aren't a lot of Black practitioners because no Black person, especially who is associated with the Tuskegee experiment or Henrietta Lacks, particularly in the Deep South, if you were a part of Bloody Sunday, if you marched with Dr. King, even now with the Black Lives Matter protests and George Floyd and Trayvon Martin and Tamir Rice and Sandra Bland, and the list goes on and on and on, we're not going to be inclined as a community to trust medical practitioners because oftentimes we often die in childbirth at higher rates, and that's another slide coming up. So we need more Black practitioners to save our own lives, and that will have a direct impact on public health's philosophy of widespread health and wellness as a community for everyone and interdependentness. So when looking at 1977 through now, we see hypertension and stroke in the Black community is another massive disparity. And just look over at the graph here on the right-hand side, and we see that African Americans are more likely to die at early ages from all causes and the three up here are just really the top three, but we're looking at cardiovascular disease, which isn't on the list. We're looking at upper respiratory diseases, things like COPD, cancer, high blood pressure, diabetes, stroke. All of these, Black Americans are much more likely to not only have the disease, but also die from the disease. And their diseases are found at later stages, which are substantially harder to treat. So hypertension and strokes related to hypertension were consistently kind of reported in the Joint National Committee on Prevention and Detection, Evaluation, and Treatment of High Blood Pressure since 1977. But they didn't have any peer-reviewed research that was specific to treating the Black community until about 1984, or after 1984, actually, 1997. So after the 1996 Surgeon General's report came out, then all of a sudden we need to focus on certain communities. But the focus hasn't really led to any systemic or hard-lined in treatment of this particular community, because we find that Black hypertension is much harder to treat. And doctors have also found that even when we can control blood pressure, we can eliminate almost all of these types of strokes that are small blood vessel related, but Black patients are not able to control their blood pressure nearly as much as other populations. And so that's a huge disparity, because now we're dying with something that can be controlled directly. And this can be accounted for maybe individuals not enacting doctor recommendations, or there's poor communication, maybe there's a misunderstanding about what they need to do, access to the medical facility, co-payments, parking fees, gas fees, not having anybody watch your kids. All of these things actually impact whether or not you can get to the doctor and get treatment. And also there's just apathy. So, I personally heard physicians say that if you're not going to care about yourself, why should I? And that's outside of the oath that they are bound to uphold. In 1979 through the present, we now talk about Black women having a higher rate of pregnancy-related deaths, 3 to 4 times higher. And this is reported by the Center for Disease Control. And these particularly high numbers related to a first world or a country like the United States that doesn't have disease and illness that cannot be treated, such as polio or other sorts of gastrointestinal issues in other countries. So we're a developed world, and we're still having our women dying at rates that are similar to underdeveloped countries. And this is particularly true for Black women now, where even Serena Williams, tennis pro, she's, arguably, but not really, the best tennis player, female tennis player to walk the planet. And even she almost died in childbirth. So there ain't no help for the rest of us. I mean, doggone. So she gave birth to a child in 2016. And even though she had a previous 5-year history of pulmonary embolisms and blood clots, and had repeatedly alerted her nurses and her doctors as to her needing a CT scan, they just ignored her, gave her treatments that weren't really in line with her medical history. And only after making multiple demands and being labeled as uncooperative did they move away from the x-rays, which is completely ridiculous for a pulmonary embolism, but they moved away from that to a CT scan, which confirmed what she already told these people to begin with. And then they were able to treat her. So this is a celebrity. This is someone who's won a dozen plus Grand Slams in tennis. And even she is subjected to a higher propensity to die in childbirth unnecessarily, just because her pain and her conditions were not valued as important by medical practitioners. And so God help the rest of us. If Serena Williams can't get adequate treatment, then we ain't really too far behind getting that same type of treatment either. So adequate treatment is not provided. There is an undervaluing of Black pain and symptoms. And the chart on the right shows the maternal mortality rate. And we see that this is between 2007 and 2018, that Black women are far above white Americans and even American Indians. And the numbers for all of them really are too high, but in proportion, this is a massive, massive inequity, ethical, moral, and public health outrage. Moving on to 1986 through the present, we have HIV and AIDS in the Black community. And just looking at the chart on the right again, we see the new rates of HIV diagnoses per 100,000 people by race and ethnicity just 2 years ago. And again, Black Americans are just so far ahead of white Americans. I mean, this is preposterous. This is a moral sin. This is unexplainable and indefensible for rates to be this high. It really shows not only the huge disproportion that Blacks are 9 times at the rate of whites, 9 times at the rate of whites, more prevalent to this disease, to HIV and AIDS, but it also shows the distrust in the healthcare system, because AIDS used to be considered a death sentence, and people can actually live a full life with AIDS now, but people are dying because they're not getting treated in time. They're not being educated. They're not being tested because they don't trust healthcare practitioners. And there's just so much apathy and a sense of we don't care in the community that this epidemic within the Black community has spread. So this is kind of similar to the Tuskegee experiment in terms of spreading things unknowingly. If you have it, but you don't know it, then you're going to infect your community. But you might know it if you trusted the healthcare professionals, but you won't go because you don't. So just similar to the Tuskegee experiment, where men thought they were being treated for syphilis and they were not, they unknowingly spread it to their wives who had children, and effects just kind of domino effect from there. Looking from 1990 to the present in the southern deep states, all the red states are the most unhealthy. And really since about 2009, when these statistics were reported, the southern states have just traded places within the top 5 or top 10 most unhealthy states. So one year it might be Alabama in the top spot. The next year is going to be Mississippi. The next year is going to be Arkansas or Tennessee. They just rotate, but they're all extremely unhealthy. Yet, despite the World Population Reviews, they are not passing or are blocking legislation such as Obamacare that directly, it helps them, it helps their communities, and not just the Black community, but also the white citizens in this area would also be helped by it, but they are rejecting it. And so part of that is impacting Black communities, because we see a lot more per capita Black Americans in these states, because that's where the slave ship dropped them off, that and on the East Coast in Jamestown, where New England colonies were. So we see a lot more concentration of Blacks in this area. But they just keep shuffling spots year to year. So the unhealthy numbers have been reported for quite a long time. These states vote against public health issues for their residents. The Obamacare, the ACA Act, has substantially decreased unemployed Black Americans by 1/3 when it was enacted. And now, of course, these states are the ones who are at the forefront of trying to get it repealed. So we see that this public health issue is very much so rooted in the way that Black Americans are viewed socially and as a community. And this has a lot to do with the history of slavery and public perceptions not being changed, and racism and systemic disregard for their health problems and concerns, to the point where Blacks weren't even allowed into medical facilities, and certainly weren't allowed to study or go to medical school until much later. That's why they started building their own colleges and HBCUs. But it just shows you how much they were not valued, so much so to where these areas in the Deep South that are highlighted red are still at the top of the list for every chronic and acute illness for Black Americans in the country. In 2005, Hurricane Katrina touched the ground and was just a massive economic disparity for people living in the Deep South, especially in Louisiana and the areas that kind of touched the Ninth Ward, the lower Ninth Ward. It was a hurricane. It was a Category 5 hurricane, and it primarily impacted, once again, communities of color. And because of that, it seems that the government and local governments, federal governments, had a much slower response rate to helping evacuating these individuals, providing food, care, etc. So much so that their lack of response and apathy towards the situation was coined Katrina Gate, like Watergate, but for Hurricane Katrina instead. Hundreds died unnecessarily, and this was due to hundreds of thousands of them or tens of thousands of them being seated or housed at the Superdome, which is really a sport facility, and they were there without electricity, uh, without clean water. They experienced massive food shortages and dehydration, water contamination, dying in decayed bodies, which contaminated also the breathing, the air, and then crime increased. And it was weeks before everyone was evacuated. And these, we're talking about broke, poor, bottom of the barrel, according to society, people that were left to rot and die for up to 2 weeks when there were plenty of resources, so much so that other countries were saying, we'll come and help. And the United States was telling them, no, we got this. And we did not. These individuals here on the right-hand side, they had to write help with rocks in order to, rocks and spray paint, whatever they can find from stores, to flag down help when this is really a public health issue, when you have that much water contamination. Even just sitting, forget the sicknesses and the illnesses and the fact that people are there, but sitting water is a breeding ground for bacteria and illness. So when you throw in dehydration and fecal matter and people, human beings, just imagine the public health outpour or crisis that creates. And so response times did not match the level of emergency, and President Bush was heavily criticized for that. As we move on to 2010 and the present, we have ADD and ADHD, which in large part has not been given the respect that it really deserves, particularly in the Black community. So ADD, which is attention deficit disorder, and ADHD, which is attention deficit hyperactive disorder, are both conditions that are actually reported in larger numbers for white Americans than they are for Black children. This is a problem because as we talk about educational disparities and how it leads to poverty and how poverty breeds chronic illnesses, we look at these kids not being properly diagnosed. This is a medical condition. ADHD and ADD, your brain doesn't produce enough of a certain chemical. And so there are scientific ways that medical practitioners can help you increase those chemicals by giving you medicines and allowing you to be able to focus, to calm down, or to focus. And so what we have is an area where these kids are seen as problematic and behavior, they are placed in special ed due to behavior problems instead of being placed with an IEP or a 504 and being given the medical help that they actually need. So pardon me, my computer is about to die, so I just need to plug this in so the presentation doesn't end abruptly for us all. So now continuing on, where this medication is not provided for these individuals, it's provided more so for their white peers because the Black kids just aren't diagnosed with it. And I used to be a K through 12 teacher, and I have seen this with my own eyes. The Black kids are put in special ed for behavior problems, and the white kids are given a 504 and given a diagnosis of ADD and ODD, which is oppositional defiance disorder. And that's a fancy way of saying, I'm not going to obey you. So the Black kids are penalized, and the white kids are given treatment and an IEP and a 504, and they are given medication. And then we have a larger propensity of the Black children who are just not treated, who are therefore not being able to focus in school. Their grades go down, and it just plays right into the school to prison pipeline. The problem with this is it's a medical diagnosis that doesn't go away in adulthood. And as a result, we have adults with this condition who are also labeled as problems, and this can lead to higher rates of crime. And of course, we know that the medical care system in the prisons is just fantastic. So this is a long-standing problem and a huge disparity, particularly looking at the numbers of Black Americans in the prison system. So it's not that these kids are problematic or violent or less intelligent. It's that they're just not being treated for a medical problem because the medical community doesn't view them as having a problem, and they are undervalued. In 2016, the National Academy of Sciences reported major biases, um, you know, it's not new for us, in practitioner pain and treatment for Blacks. However, it's a massive problem because when your pain levels are perceived to be lower, your corresponding treatment is also not in alignment or in accordance to, number one, evidence-based medical research, and also you will not be able to recover and you will suffer tremendously longer. And that has a direct impact on the mental or social dimension of health. So looking at the chart, we see the portion of patients who received pain medication. This was for emergency surgery and or emergency medical services. And we see that the Black community, and then we have others, so and unknown, so we'll just go ahead and ignore those, but the Black community received substantially lower amounts of medication, as did their other counterparts. So when you're in pain, you want your medicine right now, and they're not getting that. So it's important that we understand pain levels don't are not dependent upon race. Pain levels are equal opportunity employers, and if you break a bone, you break a bone. And because practitioners are not valuing Black Americans when they come into the emergency room or medical room, then they're not being given the standard of care and treatment along with the pain medications that can help them better cope with their situations. If you're in pain, you can't go through physical therapy as well. And the physical therapy is there to rehabilitate you and to help you live independently. And when we have larger numbers of people not living independently, then we are dependent upon housing facilities. And that is a public health problem because it's an massive economic type of the word I'm looking for, sacrifice. And also healthcare and nursing facilities is certainly not known for their high levels of treatment. So this is a big problem in the Black community. And white practitioners tend to give white patients more medicine and allow them to have a higher level of respect towards their pain tolerances, and that same courtesy is not given to Black Americans at all. So Black doctors are much more hesitant to prescribe pain medications, including narcotics, because of the belief that Black people are just going to do drugs at a higher rate than everyone else. So they're not getting the narcotics that they need to be able to recover and work through their illnesses in an efficient manner. There's so much more that I could say, but I'm quite sure I'm well over the time allotment. But at the end of the day, better together is really the adage that I want to leave with. Evidence-based medicine is peer-reviewed and or has clinical trials to go along with it by licensed and credible practitioners. Our public health philosophy situates on interconnectedness, interdependentness, making sure that our society cannot be healthy if the weakest parts of that society are not being treated. So it's the you're only as strong as your weakest link type of concept. And in order for public health philosophies to be fulfilled and realized, we have to also treat the most disenfranchised. And this just goes back to, once again, biblical constructs as well, because we see that Christ left and would have come down to earth to save even just one sinner. We see the parables of the man going and leaving the one sheep, leaving the 99 sheep and going to look for the one. So there are a lot of parallels that we can pull from scripture to support public health philosophies, and also understanding that medical health has a direct impact, a holistic impact on the mind, and the mind and the body work together. So when the body is not healthy, the mind is not healthy. And when the mind is not healthy, then the body follows suit. So these health disparities that disproportionately impact our Black communities. It touches on all of the diseases, which is why we see high rates everywhere for Black Americans instead of just one or two areas. And if it was one or two areas, we would not cry health disparity. We would say, these are isolated events, these are outliers, but everything falls within that bell curve. There are very few outliers on either end for Black Americans. And it's not respective of socioeconomic status either. So, these disparities are deeply rooted in history, and they're deeply rooted in the way Blacks have been treated since we got here, really. We have delayed treatment. We don't see practitioners. The disparities are getting worse. It's not getting better. Policies are being torn down. Clinics are being shut down in areas where there are large Black populations because of profit margins being razor thin when they're nonprofits to begin with. So culturally relevant material and training would help. This timeline can be used as a tool, one tool in many, to help educate practitioners, re-educate practitioners. But we have to start young because of adult learning theory and challenges getting people to change from pre-contemplative to action, and also helping to embed the younger society to really have empathy and godliness and kindheartedness in their practice of medicine, and also just anything, because these trends are inbred within our society. And when we use evidence-based practice instead of our preconceived notions or our prejudices, our beliefs, then we're able to better treat people instead of how we feel they need to be treated. What does the research say? I had a 10-year pathway, 11 years actually, to being diagnosed with a condition that I had every marker for, but I was told that I needed to see a psychiatrist, that I needed mental help, that I was just being given ibuprofen for inflammation when I had degenerative disc disease in all three levels of my spines, and bone spurs and bone on bone, and massive muscle spasming, and a reverse lordactic curve, and 3 herniations. And I was told that I need to see a psychiatrist. And it wasn't until, but along with bilateral ulnar neuropathy, radiculopathy, and 3 surgeries later. And this is because even though I have a doctorate myself in sports administration, and I also studied kinesiology, they didn't even listen to me, and I had a doctorate degree. So can you imagine, these disparities, and how culturally relevant training would help practitioners? And so we have to start young. Representation matters. When we get more of us, we're going to save more of us. And that's just, as easy as I can put it. And as we begin to change attitudes that predicate behavioral changes, we'll be able to start moving towards that goal of public health, to treat one, to treat all, to live healthy as an interconnected society in all facets, all dimensions of health. And this greatly includes suffering reduction and disease disparity curbing. So I hope and pray this presentation, although long, has been effective and impactful. These are my references, which I'm sure can be referred to back at another time. So thank you again. God bless and take care.